From Wana Brands, welcome to Enhance Your Life. I'm your host, Jonathan Small, and each week I talk to people from all sorts of professions and backgrounds about how cannabis has enhanced their lives and how this healing plant can enrich your life too. Well, hey everybody, welcome to the Enhance Your Life podcast. I'm your host, John Small. So great to have you with us today. Well, my guest on the show is Hilary Black, who is the Chief Advocacy Officer at Canopy Growth. And for over 2 decades, Hilary has been a passionate advocate for the cannabis plant, both personally and professionally. Her work at Canopy Growth includes driving patient advocacy efforts worldwide, executing the company's global corporate social responsibility strategy, and leading the implementation of best practices for diversity and inclusion. But before joining Canopy Growth, Hilary was Canada's first out-of-the-closet cannabis dealer. Yep, she was out of the closet, and she founded the British Columbia Compassion Club Society way back in 1997, which offered an access point for cannabis patients in need. Hilary is a recipient of the Queen Elizabeth Diamond Jubilee Award, acknowledging her significant contribution to Canadian society for her work with medical cannabis. Hilary Black, welcome to the Enhance Your Life podcast.
Jonathan, it's a pleasure. Thank you. Nice to both of us on the West Coast here. At least we're the same time zone.
Yes, indeed we are. You have a great origin story about how you sort of came into where you are now and your history as a cannabis advocate. I'd love to hear a little bit about how you first discovered the plant, just in your own personal life, and then we'll talk about how you decided to become an advocate for it.
I didn't touch cannabis until my senior year of high school. I was pretty seriously focused on my academics. So I was a high achieving.
No pun intended.
Participating in all of the extra activities. And I started consuming cannabis in grade 12, but, weekends and evenings only. And after high school, I took a year off before going to university. I was trying to decide if I was going to go into law or medicine. This is a very privileged consideration to get to make. It says something about my background that after high school, that's what I was considering. And I went on Grateful Dead tour for a year. And I'm sure glad I did, because it was the year before Jerry died.
Oh, wow.
And that was where I discovered the hemp plant. And I discovered hemp for fuel, hemp for fiber, hemp for medicine, and started understanding the environmental impacts of what was possible if we started cultivating industrial hemp again. And I started learning about the medicinal applications of cannabis. This was in 1995. And I came back to Vancouver, and the first hemp store had opened in the city. And I just started showing up there and tidying and cleaning up and showing up every day, basically until they hired me. And that was a pretty rock and roll adventure. That was the first seed bust for the distribution of cannabis seeds. And
what does that mean, the seed bust?
Well, the store distributed seeds for the cultivation of high-potency THC cannabis, and the store was raided, and I was arrested in that raid. So that was sort of my first time touching the law with, my relationship with cannabis. But that is also the environment where I learned about medical cannabis, and there were a tremendous amount of elderly folks, and mostly people living with HIV and AIDS and cancer. In the mid-90s is when we're really in the midst of the HIV and AIDS epidemic. Back when the antiretrovirals were as likely to kill you as the disease was. And I started distributing medical cannabis with a Mountain Equipment Co-op backpack and a Motorola pager and my bicycle, and just started sourcing high-grade, organic, clean medical cannabis and distributing it illegally, quietly. And then I decided that it was time to open a proper registered organization. And in 1997, we registered the BC Compassion Club Society as a nonprofit. Even though the activity of the organization was illegal, we were able to register it as a nonprofit. And we started sourcing and distributing medical cannabis to people living with critical and chronic illnesses and disease. the folks that we were working with were often dealing with mental health issues, sometimes substance use issues, as well as their medical condition. And we ended up funding and starting a wellness center where we provided access to natural health care services, acupuncture, counseling, substance use support, housing, clinical herbalists, and then provided all of those other supports really from a philanthropic perspective, just trying to meet the needs of the patient community that we were supporting. And that was really the first out of the closet public cannabis distribution in Canada. And we did a tremendous amount of media. We did a lot of interacting and consulting with local law enforcement and our municipal government and the medical community. And that organization really was the spark that started the sort of medical cannabis revolution in Canada back in the 90s.
It's quite a story. I'm curious why you were so passionate about the plant that you would even risk going to jail to work with it. What was it that really changed your view, or not even changed, but just informed your view on it, made you so passionate about it?
The first person who I ever distributed cannabis to was a woman in her, I don't know, probably late 60s, maybe early 70s, who her arthritis was so bad that she had become bedridden. She was bedridden for a few months and had home care. And she called the hemp store. I think I was probably like 19 or something then. And she wanted to try cannabis. And so I went over to her apartment, and I remember this day distinctly. She buzzed me in, and I went into her apartment, and I sat up on her bed with her, and we looked at a bag of cannabis, and we smelt it, and we talked about it, and we talked about where it came from. And I had just been learning about words like cannabinoids and the difference between THC and CBD, which was not a big conversation, in the late 90s.
Yeah.
And we rolled a joint and we smoked it together. And after just like 2 or 3 puffs, she started kind of moving and stretching like a cat waking up or something. Were the kind of sounds that she was making. And she got out of bed and went and made tea. And she brought tea back to where we were sitting. And then she cried. And she cried because she hadn't been able to carry a cup of tea in months. But also she cried because she was really mad. And she was really mad that she had been lied to about this plant, and that the relief that she was experiencing was something that had been kept away from her. And she ranted and cried. And at the same time that she was experiencing something wonderful. And in that moment, I had this vision of an ocean of people that were suffering, and this wall of prohibition that was keeping this plant away from them. And I felt this responsibility kind of settle on me, and realized that I was being given the gift of purpose, and that I was going to kick the shit out of that wall until it crumbled around the whole world. And that is the beginning of the journey, that the work that I do now is still working to break cannabis from the chains that bind her around the whole world.
So let's talk about what you do now. We're going to skip from maybe the early 2000s to now we're in the 20s, the roaring 20s. What do you do now for Canopy growth, and how has what you've done in the past informed what you're doing now?
Well, I can tell you that when we finally got to a legal regulated framework for medical cannabis in Canada, and the first big licenses were being given out, I decided that I wanted to move from my nonprofit, civilly disobedient, grassroots, frontline healthcare organization. And I wanted to move and work with one of these well-funded, usually quite politically connected companies that were getting the original licenses. And I was one of the first activists who sort of fell from my activist pedestal. And it was a very difficult time. I was criticized in very nasty ways,
Hmm.
publicly, in social media by sort of cannabis activist critics that had been my colleagues, because I was the first of the sellouts, right?
Hmm.
Of first of the big corporate sellouts. But I knew, even if others couldn't understand or see my strategy, that I wanted to move to be working with an organization that could help to create systemic and equal access across the country to medical cannabis. Because at that time, there were a number of compassion clubs set up across the country, but people only had access to the kind of services that we were providing in little pockets across the country. And I knew that these companies were going to be funded to be able to do physician education and for us to really start creating systemic access across the country. And so I started working with one of these licensed producers that got acquired by Tweed. It was one of the first big acquisitions that happened. And I sort of got inherited like a, goat in a real estate deal. When you buy the farm and get the goat, and Tweed got me. And I started as the director of patient education and advocacy. So really focusing on working with the Arthritis Society and the MN Society. And we did some very cool things like when the Canadian government had its task force rolling across the country doing consultations to get guidance from very different stakeholders on what they thought legalization of recreational cannabis should look like. They weren't meeting with patients directly. And so we organized a full day patient consultation for that task force. And it really actually affected the outcomes of how the medical system was maintained in the legalization of recreational cannabis. So we were able to have some really big influence and impact. I started taking on the corporate social responsibility initiatives, assets for educating youth, teachers, and parents about, responsible use, education around driving, partnerships with Mothers Against Drunk Driving. And then over the years, my role has changed from the director of patient education and advocacy to the chief advocacy officer. So at that time, I became the first female member of the C-suite at Canopy Growth. I'm happy to say that our diversity in senior leadership has improved a lot since those days. And my role currently, my mandate, my team and I, we're responsible for all of our social impact work. So community investment, all the social justice work, for all the patient advocacy work. We spearheaded the diversity, equity, and inclusion programming, but luckily we have now hired an expert that is running that program. So it's off my plate. And we have just tackled for the first time this year our first environmental, social, and governance strategy and report. And so now sustainability has also come under my umbrella.
Well, what do you say to those people who say that you're a sellout? Because you're doing great work. You have now the backing of a big company that has a lot of impact in Canada. So what is their argument and what do you say in response to them?
Yeah, I mean, I haven't heard that in a long time.
Good.
Because most people, many people that were prominent in the activist community have over the years transitioned into finding a place in the legal industry. But back in the day, I would either just ignore them or explain that for me, I felt a responsibility to have a seat at the table where I saw power was becoming centralized around the cannabis industry, and that we were moving from a civilly disobedient movement into a legal industry. And that working with an organization that has a team of people that educate physicians, that has research and development, that has government relation professionals that are working to break down prohibition in different parts of the world. This was where I could be the most empowered and the most well-financed to create bigger impact.
What is the most urgent need as far as advocacy? I mean, you do a lot there. So I'm just wondering, certainly in Canada specifically, where you work, what is the most urgent need? What is the biggest challenge that you face as a cannabis advocate?
I mean, if you're talking about patients specifically.
Mm-hmm.
I think that affordability is still an issue for patients, and that unless you're a veteran, cannabis isn't covered by your medical insurance, right? There are some companies that will include it in their private insurance, but public medical insurance doesn't cover it. And I would say for patients, that's one of the greatest barriers still, is honestly being able to afford it. Yeah. And then we don't have equity in Canada or in the US. So the communities of people, Black communities, communities of color in Canada, First Nations and Indigenous communities, as we know, were vastly impacted by the criminal justice system and by cannabis prohibition. And in a very disproportionate way, they are not being included in the benefits of legalization. And that is work that governments, policymakers, and the industry have the responsibility to continue working towards correcting.
Let's unpack both those issues. As far as the affordability, what can we do to make cannabis more affordable across the board to people who really need the medicine?
Well, one piece is medical cannabis is subject to the excise tax. So there is very significant tax on recreational cannabis in Canada. And if you have access to it through authorization of your physician, you should not be paying that excise tax. And that's an issue that we've been lobbying around patient advocacy groups, corporations, and we just haven't had any leeway on it. And we have to continue working. The medical community, patients, patient advocacy groups have to continue working through all of the channels to see that we can eventually have cannabis covered the way that other prescription medicines are.
And as far as equity and giving people who were so involved in getting cannabis legal and really fought the good fight, and now, as you say, have been disproportionately incarcerated, how do we get them a seat at the table? What are some of the steps that you're taking at Canopy Growth that you see being taken in Canada in general? Because we hear a lot about these social equity programs, but unfortunately, they're usually not very good stories about how it's failing, at least in the States.
Part of our strategy is around record clearing. We've decided that in our social impact and social justice strategy, focusing on record clearing is incredibly important, right? I think you are probably very much aware of the way that Indigenous and First Nations communities and Black communities are more likely, like vastly more likely, like 5 times more likely to have a felony or a misdemeanor, 4 times more likely to get pulled over without any cause, 4 or 5 times more likely to be convicted of cannabis possession. And so we're focusing on supporting financially organizations that are working on both sides of the border to clear records. And once you have a record, there are like literally 40,000 barriers that come up in your life, right? Harder to get a loan, harder to get into school, harder to get into housing, harder to get life insurance. You can't vote. I mean, it's a little bit different in Canada and the US, but when you have all of those barriers in place in your life, you increase the likelihood of obtaining additional charges and additional criminal charges, the cycle of recidivism. And so in order to make some systemic change, we want to support record clearing as a part of our focus. So we have an amazing partner in the US called National Expungement Works, and they work all the way across the country, which is phenomenal because getting your record cleared in the US, depending on what county or what state you're in, it's a very different process. And they work through an incredible network of grassroots organizations and individuals to be able to run expungement clinics. But then they also provide wraparound services that are intended to address those 47,000 barriers. So resume writing, financial skills, healthcare. During COVID, they were providing a lot of housing and a lot of food. And we have similar partners, Cannabis Advocacy, working towards doing the same kind of work in Canada. One of the things that I'm particularly proud of Canopy for is the philosophy that we have developed around how inclusive we are around record clearing. So many cannabis companies are interested in supporting record clearing for cannabis convictions. And through working with our social justice partners, we have come to really understand our responsibility to, in fact, support record clearing for any kind of criminal conviction that person is eligible to have cleared in the area that they live in because of the systemic impact of cannabis prohibition and the war on drugs in general.
I'm assuming you spent a lot of time in the United States or have spent some time in the United States. And I'm always...
Not about the last 2 years.
Oh, yeah, that's true. It's been very tricky. And things have changed.
Better.
But I'm wondering the difference in attitude towards cannabis in Canada versus the United States. And is it more similar than we might think? But, you know, Canada is ahead of us as far as national legalization. It's been nationally legal there for a few years. I don't see any time in the near future where the U.S. is going to have national legalization. It's just the way we're set up. I guess I'm a little more pessimistic about that issue. But I am curious, the differences in attitude. Do you see more of an openness in Canada towards cannabis now that it's nationally legal? Or is it sort of a similar kind of pushback among like conservative people against the drug there?
Cannabis is boring in Canada.
You heard it here first.
Now that we've legalized it and it's sold through government-run shops in most provinces, it's just really not that exciting anymore.
Yeah.
There's not the same kind of charge around it as there was. The other thing to keep in mind is that when we legalized cannabis in Canada, we legalized it with a prohibitionist mentality. So my government did not come to a place where they said, prohibition is based on lies. It's based on an agenda of systemic racism.
Mm-hmm.
Oh, cannabis isn't going to cause you cancer. It's not going to create a gateway to addiction to other substances. They said, if we legalize cannabis, we're going to reduce the harms of cannabis. If we legalize it, we can keep it out of the hands of children. We can control the product in terms of quality control, and we can give the profits out of the hands of organized crime. It's a very different mentality than legalization with a lot of honesty around what the roots of prohibition were. So we have quite a conservative legalization, if that makes sense, right? The really intense taxation, the very, very strict regulations around education, communication, and marketing. Like, it's very difficult to even do like responsible use education in association with your product because of how limited we are from actually having direct communication with our consumers. So that's basically how we sold legalization to our conservative government at the time. And now it's been a number of years. I mean, we had recreational legalization in 2018. Mm-hmm. And so people are just kind of used to seeing cannabis stores.
Now they're like waiting for psychedelics to become legal. But it's true. It's interesting that the normalization and boringness of cannabis is actually a good thing because people realize that, boy, it's not as dangerous as the, reefer madness people of the past have made it out to be.
Well, and the sky didn't fall, right?
Yep.
We haven't had an increase in cannabis-related traffic accidents. We haven't had an increase in mental health issues related to cannabis. We have not had an increase in terms of youth use, right? And so all of those public health policy issues that we're concerned about, the statistics that are coming in are starting to really show that the sky didn't fall.
Yeah.
Right?
Thank goodness. And we didn't expect it to fall, and it didn't. I hope some U.S. politicians are listening to this podcast. So you have done some work with Canopy on the opioid overdose epidemic. Talk to me a little bit about that.
So I know the statistics in the U.S. are as bad as they are in Canada, and that the opioid overdose epidemic is killing people from all walks of life, from all ages. And, this stems from our prohibitionist mentality about how we're managing substances in general in our societies. But it became very personal to me a number of years ago. And I will always be touched and grateful for the way that my company responded. So my best friend's daughter, Gemma, who was 18, died of an overdose 4 years ago. And I took a couple of months off of work to support the family. And when I came back to work, my CEO at the time, Mark Coolin, said, well, Hilary, what are we going to do about this? Like, we know anecdotally that people who are weaning themselves off of either prescribed or recreational opiates can use cannabis as a tool to help get out of addiction, right? I have worked with people trying to shed their opiate use, whether they're patients or people who are getting it from the illicit market for decades, and have seen tremendous success. But we still have this notion based on the reefer madness era that cannabis is a gateway into addiction rather than a gateway out of addiction. So I worked with a number of colleagues, and we essentially came up with a plan. We created a 3-way partnership between Canopy, the University of British Columbia, and the British Columbian Ministry of Mental Health and Addiction. So the government put in $500,000. My company put in $2.5 million. And we created the world's first professorship of cannabis science. An incredible man named Dr. M.J. Malloy, who in fact you should interview sometime. He's phenomenal. And they are doing research to start gathering a body of clinical data to show how cannabis can help people out of addiction, to create a gold standard body of clinical data that physicians, addiction specialists will be able to lean on in future years. And some of the impacts that I'm hoping to see from that is perhaps when people go into a rehab facility for their opiate addiction, it won't be considered commonplace to be zero tolerance anymore. And perhaps people will be able to take their soft gels or take their vape pen into their rehab facility. And I really believe that in the future, we're going to see cannabis as one of the tools that is being used in harm reduction and in managing substance use issues. So in Gemma's legacy, we have created this professorship that is really doing some phenomenal work.
That's wonderful. How's your friend doing? Yeah, it's hard.
Some days are better than others, you know?
Yeah.
Yeah.
Tell me a little bit about how cannabis has enhanced your own life. We've heard about how you've seen it enhance the lives of those that you've met in your life. I'm curious how you use cannabis in your own experience. Are you able to talk to us about that?
Sure. I mean, I love my high-end sativas. So I'm, like give me a haze over a big fat kush any day. I inhale quite a small amount. I'm pretty lightweight these days.
Yep.
I consume it pretty much every day. It's sort of my break between the Zoom is shut off for the day and the dog walk and training exercises are done and dinner is prepped. I don't have to answer the phone anymore. So I don't really use cannabis to like crash out at night. It's not like a sedative for me. I more want it when it's time to like put on some good tunes and have a dance in the kitchen and like really enjoy what I'm cooking, or maybe do something crafty. And it helps me to shut down my brain, right?
Yeah.
And when I can shut down the busy work brain, I can be more present with my family. I can be more present with my intimate partners. I can be way more present with my dog. I can enjoy the beautiful nature that I live in. I think during COVID, if I didn't have cannabis in my life, I probably would have started consuming more alcohol. You know, I think we really saw alcohol consumption rates kind of go through the roof. And I use cannabis instead, right? And then medically, if I am in pain, sometimes on a monthly cycle, I am in pain. And I really love the soft gels. So I love our little soft gels where they're perfectly dosed. So I can get 2.5 milligrams exactly. And that's generally about the right dose for me. And then if I need a little bit more, I can take exactly 2.5 milligrams and they just look like my vitamins. And I take my CBD every day, same as I'm taking, my vitamin C and my evening primrose oil and whatever else I'm on for vitamins and supplements. I have my little CBD vitamin that I take every day. And I believe that feeding my endocannabinoid system on a regular basis helps me to stay in homeostasis, and I will be less likely to develop illness and disease.
That sounds good to me. I want your regime. Have you been able to stave off COVID?
No, I have gone through COVID.
Mm-hmm.
Yeah, I didn't get devastatingly sick, but it definitely touched me for sure.
Well, I think it's touched us all. I just went through it. I actually got it in Vancouver. Your lovely city. I did get it there, but I'm okay now.
Well, I hope you're recovering well. I know
am.
some people end up being tired for quite a long time.
Nope, I'm fine. I have a little bit of a cough, but nothing that cannabis can't cure. So Canopy Growth just released a environmental governing report, the ESG report. And I'm really curious to find out what that was and what you found out.
Certainly. So for publicly traded companies, ESG reports and your ESG score is starting to become table stakes. Regulators, investors, particularly institutional investors, consumers want to know, how is your company performing in terms of how it treats its people, how it is investing in community, what its environmental impact is, and what the plans and targets are for reducing and improving those things as required. So a number of years ago, some of the institutional investors were coming to us looking for, where is your ESG report? Where is your score? Because there are rating agencies that evaluate companies based on hundreds of data sets and produce eventually a score, or also will assess what the risk is of investing in this company based on how it's performing. So it's all of a company's performance data that's not just the financial performance data, but all of the other ways that we're performing. So as you go through that process, you do a huge material risk assessment. You interview a tremendous amount of both internal and external stakeholders, and you decide what your priority focus areas are going to be for your report. We also undertook this year our first ever fulsome environmental footprint and assessment, and we have now published that data. That's an uncommon thing in the cannabis industry. There are a couple of companies that have published some data, but it's going to start being table stakes for all of us to be public about how much water you're using, what's your carbon footprint. And, this is a resource intensive industry. Working in the corporate culture, getting used to this idea of us measuring and disclosing our performance around our social impact and our environmental impact has really been a tremendous journey. And I'm very, very proud of my company for the work that we have done.
What are some of the findings of your report that were surprising to you?
Well, there weren't too many surprises, but we had to boil down what we considered sort of our highlights. I was very happy to see the cumulative data that over 2020, 2021, during the course of the pandemic, we invested $1.8 million into community record clearing services, food security, and supporting education around cannabis. I think that's a pretty impressive number.
Yeah.
We have achieved 48% gender parity at one time, honestly, back in the day. Tweed and Canopy Growth, it felt a lot more like working in a boys' club, particularly at the more senior leadership levels. And now, if you look at our executive team, we have a crew of very talented women who are also working to run this company. We did our first ever environmental footprint assessment, so evaluated all of our water, waste, packaging, carbon footprint. And, the first step in a company being able to reduce these things and to improve your environmental performance is you got to measure it and you got to disclose it. And that was a big job. And we've got that first step. And in the beginning of the pandemic, when our first responders and healthcare employees, when everybody was really worried about PPE, there just wasn't enough in the supply chain. And the
What's
people
PPE
that were
again?
Oh, sorry, protective gear. So
right.
masks and
K95,
gloves.
yeah.
And because of the way that we run our GMP compliant facilities, we have incredibly high standards around sanitation. And so we actually were able to donate 75,000 pieces of protective gear for healthcare workers and frontline responders in the beginning of the epidemic. So number of things that I'm pretty proud of.
That's great. Hilary Black, thank you so much for taking the time to talk to me today.
What a pleasure. It was really lovely. I hope one of these days I get to get out of my Zoom box and perhaps we'll get to meet and chat in person.
I'd love that. And maybe you could bring some of those soft gummies with you because those sound good.
Enhance Your Life is brought to you by Wana, the #1 infused product in North America. Wana's entire process is designed to deliver the same great experience time after time. They have spent years fine-tuning their recipes so that their products are delicious, consistent, and potent. For more information, head on over to wanabrands.com. That's Wana, W-A-N-A, brands.com.